Hi,
Hey, hey,
as if we didn't talk before I pressed record on this whole thing.
it's all right. We
Playing
have to
like
make
we
it
just met.
official.
Okay, so we're back again this week, and we have lots of topics to cover over the next few weeks. But this week we want to talk about things we see on the internet that supposedly fix concussion. The one thing that supposedly fixes concussion. And there is no, as we know, there is no one thing that fixes concussion.
Correct. I'm just grabbing with my, as we talk, I'm grabbing my beautiful instrument that can find anything in
Yes.
2.2 seconds or less
Yeah.
and just typing in what'll fix concussion. Because we all have social media these days, and there's
Mhm.
always trends that are aged or linked to your demographics or your search engines or
Mhm.
those kind of things. Or like you said, you started even getting things that you didn't talk about that maybe, or that you haven't searched for, maybe, related to things we talked about on the
Yeah.
podcast last week when we
Yeah.
recorded, where you go, okay, we're talking about doing fascial manipulation on the head and neck. And now all of a sudden you go, hey, now I've got this stretch from Instagram on opening up my soft palate, my face, and my
Hmm.
breathing apparatus, which maybe it's our fault for recording this last week that you got those things. But anytime you get on and you search like on a Google concussion cure, concussion treatment, your Facebook algorithm and your Instagram algorithm and all those things is going to be loaded with a lot of that stuff. And I know you'd mentioned you'd seen something that said you do this and your concussion is fixed.
Yeah. The thing I always go to, because I give free 20-minute consults when people call, I'll talk to them. If they want to come in, I'll talk to them. But the reality is almost every time I say, you have to know what a concussion is. And a concussion is a change in function of the brain. Okay, what does the brain do? Everything. It does everything. They're getting to where they're breaking down different types of concussions, emotional, hormonal, headache, visual, I can't look them all up.
Vestibular,
Yeah.
proprioceptive, etc. Yeah, you
And you
could.
can have one or all of those. It's all possible. But if you don't know the definition, it's kind of like when people ask, does acupuncture work? For what? What is your target?
Right.
And then what is the therapy? Because if you know what you're targeting, there could be a few different ways in to that therapy.
Very much so, very much so. And that's one of those things where I think in my career I've always erred on the side of caution because you go to a class and all of a sudden, whatever it is, whether it's a carrot class, which generally we do in Carrick a really good job of explaining why we would use the therapy
Detailed.
and
Detailed.
maybe when to apply it and when not to apply it, although there are people that maybe don't get that message all the time.
Yeah.
Um, other
Yeah, you
other
hear the
things
same
that
thing. You heard it in one class, you hear it in the second class, you finally hear it.
for sure,
Because you've had an experience and you're like, oh, that's what he means by that.
yeah, and
Yeah.
you get that, and you go, these are all 15 to 20 to 25 hours of material most of the time that we're getting. So it's a lot of evidence based and so on and so forth. But you can go take an hour seminar from somebody and get
Hmm.
certified as a concussion specialist. And that's the thing where the thing with the accrediting bodies and the accreditation process and the board exam and all those things that we've gone through, which are extremely rigorous, they tend to turn certain people off because maybe they're in a practice already and they've got a demand. They're in an area where there's a lot of concussions and there isn't a concussion specialist, and they don't want to spend 300 hours to become a concussion specialist when they can go somewhere else and get a weekend certification,
Hmm.
do whatever technique they want to do,
Have
not
a
knowing
label that
exactly
says
why they
that they're
apply
a
it.
concussion specialist. Yeah.
Yeah, I've got a credential now, which may or may not be recognized by anybody that matters.
Hmm.
And again, you start to get into all sorts of professional liability issues and things like that, depending on what state you're in, et cetera. But my attitude has always been, I've been, like I said, pretty conservative. If I learn a new technique, I'm not just going to come in and apply it on everybody until I really understand what am I doing? What am I acting on?
Hmm.
Why would I want to do this with patient X and not patient Y? And sometimes maybe I still don't completely understand it because of the complexity of the system. So I will tend, for years, I didn't use a lot of fast eye movement therapies with people because I was just worried that I would be haphazard in it.
Well, and another way to flip that is while you're in class learning these things, the way it's described, I actually take it back to patients like, oh, I wonder if that would have been good in that patient. Or I have a
100%.
patient right now, so I will apply it in those and,
Yeah.
see what's going on. So there's two ways to look at it. Yeah, the
And
first time I took a neuro class, I was afraid to touch anybody. And I already had my chiropractic license for 6 years and felt
yeah,
confident in what I was doing. And I was like, I know nothing. Why was this not the basics for what we,
and
learned in chiropractic school?
it really should be. It's so much the bridge from the basic sciences to the clinical sciences to the application and treatment really is what we get when we're character trained, in my opinion. And
Yeah.
the thing
And
with
it's
that,
not a, here's the other thing. It's not a technique. Care treatment is not a treatment. It's not a technique. It is an
or protocol.
understanding. It is an
Yeah.
understanding of the nervous system and how can I do it? Because you can make up it. Say you're trying to get this visual field over here because you're trying to get that temporal lobe, and it's on the left side. So you may want smaller squares versus bigger squares. That type of thing.
Uh,
There's no technique for that. It's just an
it's
understanding,
understanding
and
what
you
part of the brain
apply
is
a thing to
activated.
it. Yeah.
Yeah. And that's the thing. I hear that all the time from general practitioners of chiropractic or even physical therapists or other people in the allied health fields that will refer me a patient, which it's like, thank you for the referral, number
Hmm.
one. Number two, there isn't a Carrick protocol.
Correct.
Our protocol is to examine the patient, understand where the deficiencies, imbalances, and strengths lay in their system,
Hmm.
leverage whatever those things are in an appropriate manner, and hopefully take, like you said, the concussion is a change in brain function. It's deleterious generally, right? You
Hmm.
don't generally see people, except for maybe the first 2 or 3 or 4 hours after a concussion, look like really good because they're so hyper excitable.
Yep.
It's like, oh man, I had a concussion and I'm giddy and I feel really great. Like,
Yeah.
this is going to be bad tomorrow, right?
Yeah. The
But
denial.
generally, it's a deleterious change in brain function due
Yep.
to a physical and neurochemical cascade that
Hmm.
insults the brain, right? So what I'm going to do is try to use whatever the therapy is, one of those that you mentioned. If you're ready for me to mention it already,
Go ahead. Yeah.
nasal balloon technique, right?
Yeah.
Where you go, okay, what am I doing? I'm gonna take a balloon, I'm gonna take it up into the nasal passage
And
under
we're
the
talking by
palate.
someone who is trained, just to clarify. We're not saying anybody
It's
online. This is not medical advice.
don't
Don't
go
go
and
shoving a balloon
buy
up your
a
nose. There's a technique
please
involved with
don't.
that.
Yeah,
So just to
nasal specific
make sure
technique is what
that
it's called.
description's there. Yeah.
Yeah, nasal specific techniques, what it's called. I would say if you're gonna have somebody do this, make sure they're certified at a minimum
Hmm.
in that for sure. We have a colleague in Sweden that does this a lot with people, and Pendleton had it done.
Yeah. I
Yeah,
remember.
Dr. Pendleton. Yeah,
Yeah. We
he
may or may
raved
not
about
have
it
done this in a hotel room.
by somebody who is again
The
licensed and
crazy, crazy
competent.
chiropractic, get
Yeah, but
together.
that's what we do. We get together and it's like, man, I haven't been adjusted in
Hmm.
6 months and I'm finally here and I get to see you. And
Hmm.
so Dr. Sockander did this on Dr. Pendleton. These are colleagues of ours who are Fabirs. They're trained and boarded in brain injury and rehabilitation. But Michael raved about how well he could breathe for a really long time after Dr. Sockander did that with him.
Yeah.
And Dr. Sockander is very competent, proficient,
Hmm.
uh, clean technique on this. So please, again, if you're going to do
Yeah.
this, but what you had seen was an ad that said this is a
Well,
technique to fix your concussion, correct?
yeah, this doctor treats concussion through this. There was no descriptor, and maybe there is. There was no descriptive. We look at all these things. This is one technique that we used along the path of this person and their concussion. There's none of that. It's a TikTok and Instagram, so they're short.
Sure.
Maybe there's more to it, but the gist of it was like, oh, that fixed, the concussion issues that have been
So
going on.
that's the problem with a lot of advertising is it can be very
Hmm.
misleading or maybe not by intention. Again, I'd like to
And it could.
give the
It could on
practitioner
that
the
person
benefit of
have
the
been the
doubt.
thing that activated the
Yeah.
certain part of the nervous system that needed it.
Like I talked about with my patient the last time we got together, where I did the deep neck flexor work, and it was the thing that
Yep.
opened the heavens and I just saw the patient yesterday after a month and he's still like tip top after we did this. So he's
Yep.
golf, jazz band, working out, etc. He's excelling in life like he did before his injury. But again, if I'm going to post that technique and say, hey, this is a technique that I use with concussion, I'm going to say we picked off a lot of other things before we got to this. I'm not going to go deep neck flexor work fixes every
That's it. That's a
concussion.
concussion. The only problem is
Yeah.
that, yeah, yeah.
Yeah. Do I see that a lot in my concussion cases? Absolutely.
Hmm.
But again, it's not the only tool that I'm using. and it's not the way I would say this, if we have we've been through 350 postgraduate hours specific to brain
Just for
injury.
the Fabir, not the
Yeah,
every year research and the
specific
other
to
that, yeah,
treating and rehabilitating brain
not our
injury.
masters, none of
We've
that.
been
Yeah.
through a 300-hour neurology diplomate program. We have to recertify with at least 30 hours every year on those types of things. We've been through our master's program as well, and both of us had some traumatic brain injury focus in our master's program.
Mhm.
If there was a magic bullet technique, we would have found it by now.
Yeah.
Professor Carrick would have found it by now, and we
Yes.
would all be doing it.
Yes. Yeah.
And if it
The,
was that easy, not that that technique is easy to do, master, etc., but
mhm.
again, if it was that easy that we had the same treatment we could use for everybody, there wouldn't be post-concussive syndrome. We wouldn't have all these athletes that couldn't
There
play.
would
We
be a
wouldn't have,
TikTok that people could go on, do it, and they'd be whammo
and
bammo
everybody would
better.
be 100%
Yeah.
cured, fine. We wouldn't have the 1.2 million cases of disability per year related to traumatic brain injury. We
Hmm.
wouldn't have, again, we wouldn't have people with moderate brain injuries that were out of the workforce, unable to work again, etc. I have a patient right now that's like, if you could do that and that would fix me, sign me up.
Yeah.
It
And I
just
would
doesn't
feel
work
good,
that way.
from an ego standpoint of a doctor, it's like, I got him better in one visit. Of course, that would be
It'd be fabulous.
fantastic. But
Yeah,
the whole point of practice is you see people, and some people you push too fast, others you push too slow. That is
100%.
just the nature of it in your observation. You know, Carrick, his observation skills are like nobody else.
Second to none.
That is the biggest thing that I have learned. Everything that he observes, down to, I don't want to give away stories that I've heard that he has told me. Court cases where the attorney is like trying to do
Yep.
something, so he starts doing a little head nod because he knows what's broken, kind of in that,
Yeah. He'll
it
he'll
turns in,
tilt his head a certain way a few times and throw their skew deviation.
yeah, yeah. It's like,
Oh, to be
oh,
that,
and then knows
it's
how to
it's
do that, but
it's like the real life Dr. House, but nicer, right?
yeah,
You just go,
yeah,
holy crapola.
yeah. But anyway, the point is he's gotten that good because of the people that you see over and over.
Yeah.
Nobody's a research paper. The clinical aspects come into it, and no two people are the same. So to go back to what you see online for what helps concussion, if you have a diabetic who got a concussion, you probably need to start with their blood sugar and their insulin and the inflammatory markers. I don't know. I haven't
Agreed.
seen the person, but that is absolutely the conversation and thing that I would be harping on the whole time, because you already have this level of inflammation with your diabetes. Boom, a little bump, and there you go.
Odds are good. Absolutely. Sorry, I have a concussion patient message me right
Oh,
now.
okay. Okay.
So no, it's totally fine. This is the one that's like put a balloon up my nose and fix me
Yeah.
and be the happiest
Yeah.
person ever, right? So but that's the thing is you can find a lot of these things. There are a lot of general practitioners of chiropractic who use certain specific techniques on a certain part of the spine that again they say they're concussion specialists.
Could be the upper cervicals. Okay. Well,
And
how do
that's
you fix the vestibular system? How do you actually fix the eye movements? That's not, there's so
and
much more to it. And if your neck, so if your evaluation is looking at upper cervicals, and your things change, your measurements change, but their autonomics are shit. They can't sleep. You haven't fixed all those things.
yeah.
Maybe you don't want that joint to move yet.
And that's exactly it. A lot of times, and you'll hear Professor Carrick say this all the time, we don't necessarily want to treat a compensation because if we decompensate a patient who's compensating, the
Yeah.
result can be extremely deleterious. He'll say, well, great, the neck moves better, but now they've got a tremor, or
Yeah.
now they've got a full-blown dysautonomia, or now there are things like that, which again, if your only focus is on the nose and how well
Mhm.
those nasal bones move,
Or just the eyes. I could say the same. Or
correct.
just the eyes.
Correct.
Or
Or
just the
or
vestibular
or the
system.
mechanics of the upper
Yeah.
neck or the tone of one muscle compared to another.
Yep.
If you're not doing a relatively comprehensive job, and again, the thing I get all the time too is I'm an instructor for the Carrick Institute as well. And the cohort will ask, especially earlier in the program, do I have to do all of these tests all of the time on every patient? The answer is not necessarily. The answer is a lot of times, and you'll see Professor Carrick when you follow him, his exam is somewhat
To your
similar
point.
in certain
Yeah.
things that he looks at, but the thing he is, again, observation and historian.
Well,
The
and
man generally
repetition.
knows.
Yes.
Yes,
So
yes,
the answer is yes. Do all of them. Do what you can remember and just
for
observe.
sure.
You may
Get
not see
good.
anything. Go with your patient who comes in for nothing.
Yeah, get good at
Well,
everything.
you,
Absolutely. Get good at everything because
and
that's
then
the other
you're
thing.
then you can fine tune as you observe those things over and over and over. You know, because I think of like Romberg's test or arm slap test, right? The arm out in
Yeah.
front like this, one hand above the other, or
Yeah.
you get splaying of the hands differently. There's so many things that are not part of that test that you
Yeah.
just start observing. I rarely see someone, usually, so that test is, do they rebound up? I had one patient, I've had actually two, that when you hit it, they like do this hyper thing. And I'm like, oh, and it relates to the frontal lobe on that person.
You see, yeah, is that a
But,
frontal lobe issue? Is that a cerebellar issue? You could see it be a
and that,
peripheral neuropathy. You could
and
see
those
it.
are not textbook exams and what's
Yeah.
supposed to be there, but you have to understand the nervous system to explain why that is the reaction.
Memorize Dr. Mazion's book from clinical neurology in school, and it's like, well, that's a posterior column test. Sure, it is.
Okay, and then what?
but but it's also a test of the end organ, and that's the thing that we do is we learn to walk every examination aspect from the end organ all the way up to the cerebral cortex, and everything that's in the middle is a possibility because the thought
Yep,
process has always been localize the longitudinal level of the lesion. Unfortunately, with concussion, it tends to be a network disorder. If you read
yep.
that nerd paper that
We're
Dr.
gonna, I think
Gray
that's on my notes to, for us to
talk
talk
about it.
about that. Yeah,
Yeah, but
it's
they
really
wrote a
great.
paper where they talked about how it is a multifactorial network disorder, and that's why you've seen all these things happen. Like you talked about subtyping concussions, which you can use a Rivermead post-concussion questionnaire
The one I use
and,
the
and
most.
kind of start to do with people. But that's the problem. You see so much crossover in these things where you go, yes, I have to treat the neck. Maybe I do have to treat the nose or the face or
Yeah,
whatever. I've got to at least look at the eyes. I've got to look at the balance and the vestibular proprioceptive and graviceptive system. I've got to at least check those things.
yeah.
And that's the thing that we're doing, whether it's through observation or through specific test
BNG,
parameters or
balance
whatever.
test, whatever,
We're always
people.
checking it. Yeah.
Yeah,
I'm checking that when my patient walks in and when my patient walks out.
yeah.
It's this gait. Gait is one of the highest level functions of brain.
Yes.
And you're
Oh,
testing
I
all
can't
of
drive
those
down the road
systems.
without analyzing a gate. I mean,
Correct. Correct.
it's impossible at this point.
There's a girl that runs about the same time I go home every day now. And it's like, oh, you're in the wrong shoes. You've got no arm swing, and I'm like,
You're
I
like
just want to
this,
grab
your
her.
abs are weak,
Yeah.
whatever it
I'm
may
like, I want
be.
to grab her and do like some Hal Maggies and some figure eights and get her to swing her arm and
Yeah,
get, an arch support because you pronate like crazy. And I'm just thinking, what's that pyramidal weakness look like? Right.
yeah,
But but that's the thing too. I just was messaging with the mental health therapist that's starting to funnel some FND patients
yeah.
and dysautonomia patients my way. And one of them, I've gotten enough data on her now. It's like on good days, she's going to have a pupil that's a little smaller on one side. On bad days, it's going to be completely the opposite. And she's like, yeah, yeah, yeah. I mean, and that's you can tell with me too.
Yeah.
If you're in my class and you see a really small
I don't
pupil,
know. Can you even
small,
see my pupils if I look here?
yeah, you got a little bit of a differential there.
Yeah. When I make videos, the ring light, for example, I can see my this eye goes out, the skew deviation on it. I'm like, I don't know if people can see these things. I know I
Yeah,
do because that's what we look at, but
yeah.
so it's hard to watch it back, but yeah.
I'll have it too. Yeah, I'll have some discrepancy there for sure. And it's interesting when I'm really, really fatigued. Sometimes it's like, oh, do I need reading glasses? I don't need reading glasses right now,
Mhm.
luckily, even though I'm at the age where it's like, do you need reading glasses or
Get
not?
that red light in the morning, heal that
Well,
lens.
and that's it. Yeah, I just actually, as we were getting on, I was finishing up ordering an apparatus to take home. I've got a red light
Oh,
here, but I want one at home too.
okay. Well, the morning, the sun, get up
Yeah.
before UVA and sunrise as like the freest, best blast of red light. But yeah.
Yeah, and that's one of those things at future topic we're going to talk about sleep wake cycles and
Yep.
those kind of things and processing of visual fields. It's really cool. That's why we called this what we did because we kind of just
Neurovirgin.
bring
Yeah.
everything in all the time. But that's one of the things. Like I said, I'm looking at what are cures for concussion? The nasal specific technique one is an interesting one. I'm
Mhm.
seeing people now advertising Brock strings.
Oh,
And it's like I
talk
did a
about screwing a person up if you don't
yeah,
know what you're doing.
yeah,
Oh, yikes.
I did a 4 hour eye movement training, and I'm again there's one of those that's popping up on my feed.
Yep.
Concussion certifications is what I see. It's not necessarily here's the therapy because it's marketing to me, my algorithm is marketing to me as a provider.
And at this point, those weekend courses that you and I see come up, sure, if it was condensed and it all made sense, and we would have at this point made it into a sweet little condensed little thing. But
100%.
it's
That's
not because the more experience you have, the more you see, the more there's no way to make it linear. There's no way to do it. And
it's
you
not a
only
linear
learn that by
process.
experience. So there's people who take the weekend course, the one weekend course, and they go back and they're an expert and they're treating all these patients. They'll eventually learn that they're screwing half of them up. I question myself. I'm
Maybe,
like, I think we're doing right,
maybe. Oh,
I
every
do the
day.
best I can.
And that's the thing Professor Carrick always says too, is he
Yeah,
thinks back, to every case and he's like, how could I have done better
that
with that
better.
case? Yeah.
Yep.
I do that all the time too. It's like,
Yes.
how could I, oh, great. I'm glad you're doing better. How could I have cut the time in half? How
Yes.
could I have gotten you there faster
And
and
maybe you couldn't.
completely?
One thing, so I've taken some business courses, right? Because as a chiropractor, you're your own business. You're not working at a hospital, most
Yeah,
likely, or for someone else. You have to understand business. That's what it comes down to. So a lot of the business is a system to streamline things. And
100%.
that is very hard to do with anybody in healthcare because as much as there's a neurovergent, we all have these baseline things. Everybody has different trauma in their life, different things that they've done, different diets, different, there's so many things that are so different. It's hard to streamline that. So when people say how many visits it's going to take, I don't know. I would like
And
it to
that's
take
the
the
thing.
least amount possible. Do what I say. We'll see how you respond. There could be genetic SNPs. Maybe you don't methylate well, so therefore your neurons can't do it. You know what I mean? There's so many things that can go with it.
And maybe you don't know that you have a different SNP where if you overmethylate, you're causing yourself problems until you take your compounded tirzepatide.
You know what relates to MTHFR genetic SNPs? Tough guys.
Well, I do have that.
Yep.
Yeah,
As we learned before we
I'm a
started filming.
677. Yeah. Interesting. Yeah.
Yeah.
So yeah.
So in short, let's go back to that balloon one because when I don't get stuffed up very often, I actually have pretty good sinuses and
Well,
face development for that. But
one and then two,
when
I
I
think a
have,
lot of your dietary choices are very
yes,
helpful for that
I'm
as
pretty
well.
uptight
Yeah.
about diet.
Same.
So thinking of that balloon up there, when I do have a stuffy nose, just sounds like heaven. Because not to get gross, I'll stick my pinky up and I'll push like in
Sure.
different areas, or I'll pull on the nostril in different directions to get the tension, and it just loosens it up.
Well, and there's so many things you're doing with that technique. Not only are you mechanically moving a cranial bone that
Yep,
is involved in the pathway, not only are you doing that, you're also causing a fast stretch on the fascial components around the soft and hard turbinates,
yep.
et cetera, et cetera. You're also giving a stimulus to the sphenopalatine ganglion, which
Hmm.
is an autonomic regulator of mucus thickness, of airway dilation, of blood vessel dilation, all these kind of things, which, Dr. Hoffman talks about in his program. There are different other ways you can do that as well if you can't do the balloons up the nose, and his
Hmm.
program's great. Um, but it's just one of those things where you're looking at that. You maybe could have a similar outcome doing, insufflation technique, which is another thing. We had a colleague who was doing insufflation for migraines with every patient.
Hmm.
And he published it, and it's
Yeah.
it's turned into a thing. And you go again, insufflation helps, and I've made it part of my
I just had a
treatment.
migraine patient. I'm like, oh, that's a good option.
Yeah, but
I forget.
it's
You
an
don't.
option. Well, and again, yeah,
Yeah.
we have so many tools in our box, we kind
I
of
did
forget to use
vagus
them all.
nerve on this one and median nerve for her, among
And
other things. But those are the electrical aspects I went for acute migraine, but
But it's the
on
same
her.
thing. Does insufflation help every migraine patient?
Correct.
No,
No.
absolutely not. But it's the same kind of deal as we're talking about with this concussion. You can get a device. There are devices that are specifically marketed to migraine that do insufflation now.
Hmm.
And it's like, hey, maybe it's the miracle for you. You see a lot of people get the tragus piercings or different other piercings because it's all in that trigeminal vagal
Yep.
apparatus that we've learned so well. And doing some of those mechanical things could be very helpful. But again, some people are like, the piercing helped me a ton. Some people are like, the piercing didn't do a diddly poo for me.
Yeah. Yeah.
Because
That's
again,
too
like
much
you
of a
talked about,
commitment for me.
what are
I'm
your
lucky
diet?
I have these holes.
What are your
Um,
dietary strategies? What are your
yeah.
inflammatory status? What do your hormones look like? All those things really do matter. And every concussion patient, like you said, they bring their entire plate to the concussion, which is why we can't standardize everything.
Speaking of, if I had to generalize, my toughest patients are almost always female, and they're either at the beginning of their cycles or at the end of their cycles. It's
And
not as much at the middle. It's
well,
unless they're
and
dysregulated in the middle. But that menopause or perimenopause, getting in that area, and the teenagers that brain's not developed, they're not eating right. This is where I don't think school is good for kids. You're shoved into this academic world with these weird things that you got to do. And socially, I think it's not normal. We did not, our ancestors, school is very new. People don't realize school is
right.
very new to make employees. People were at home and you developed normal and safety. You were more in tune with your parents so that your parents could identify what's going on and help you through it. And these kids are now talking amongst themselves with their weird parent advice, followed by their TikTok advice. And so
Yeah.
they're not eating well when they're coming in. They're not getting normal light. They're trying to keep up with the Joneses. There's so many things going on. And then you had a concussion, and it's like, I need you to
Yeah.
not be so much. I need you to.
And you look at again, yeah, what is that hormone period? I may have actually quoted you at CNS2 on the whole teenage girls with concussions thing.
When people tell me that, I'm like, what did I say? I don't even know. I
I,
don't
I
even know what I
quoted you on
said.
that. I, I
What
said,
did
I
I say?
said, well, and what I went in and I said, if you ask most neuromates what the hardest cases are,
Mm,
we're going to tell you one of two things. I'm like, we're going to tell you dystonia cases are very difficult to treat.
yes.
And we're going to tell you that teenage girls with concussions are very difficult to treat. And I said, and I am quoting Dr. Julie Brown on this, that we're most difficult patients to deal with on the daily basis
Yes.
because of the complexity of the system, the
Yep.
hormonal milieu, and
Mhm.
all of these societal cues, as you've talked about, for those patients are very much confounders.
Yeah.
Boys too, but girls especially. Yeah, you talk about that. Why, and you look at it, why do the hormones matter so much at that period of time? Because those hormones for females, when they're
They're laying down the
in
myelin. They're
optimal levels, are very neuroprotective. You're getting higher levels of brain-derived neurotropic factor. You're getting different affects on not to go back into the alphabet soup, but Sonic Hedgehog and some of these other organizers. Now people are starting to talk about those because they've
Oh
got
my
peptides
gosh.
that can leverage it.
PTSD from my master's right
Yeah.
there.
But that Norman Hoffman calls it the alphabet soup, and I'm not going to get into the alphabet soup anymore. But it's like
Okay.
people are asking me about Sonic Hedgehog.
Okay.
They come in again off Instagram
And
and
we're
off
not
of
talking
TikTok.
about the video game. We're talking about
We're talking
genetic
about
expressions.
a genetic organizational rostral thing that really helps to organize your motor system. And what you're seeing is people with motor dysfunction.
Mhm.
Maybe there are peptides that can leverage Sonic Hedgehog and help with brain repair. People
Yeah.
are asking about peptides all the time. Again, what peptide should I take to fix my brain? Well, again, is it being made in a bathtub in China?
Here's the peptide I tell you to take, which is not a peptide, ketones.
Beef.
That's one I feel comfortable advising.
Well,
Not a
and the
peptide,
thing
though.
with ketones, like again, why are ketones so darn good? Because brain really likes it. It's an easy fuel source. It doesn't overdrive the brain, but it helps provide fuel for these relatively deleveraged pools of neurons. It also helps to promote good
It's an
bacterial
antioxidant.
balance in the brain and the
It's an
gut too, the
antioxidant, so it
flora.
puts out that
Yeah,
flame as well.
yeah,
Mhm.
and gut really likes it, and the bacteria that
That feeds the
like
bacteria.
butyrate, and
Yep.
some of those other ketones in the gut
Yep.
are also beneficial for promoting things like sleep, wakeful cycles, promoting brain-derived neurotrophic factor secretion, and so on
Yep.
and so forth. They secrete body protection 157
Hmm.
compound, which is the BPC
BPC
157.
157. Yep.
It's like, yeah, we make these things naturally. The kidneys make it. There are bacteria in the gut that make it, et cetera. So you go, that's why ketones are one thing that you could probably say pretty safe across the board, right?
Yeah. I feel unless you have a genetic snip that you can't break I think it's break them down. Can't
Yep.
remember, but
There
it's
are
so rare. It's
exceptions.
such a rare snip.
Yeah. There are
People would know they
exceptions.
had it before they even came in with a concussion.
Generally, yeah,
And that would be
they're
on the
going to flag it.
paperwork or asked, do you have any other, comorbidities and whatnot?
Absolutely.
Um, to go back to that balloon and the different things saying, oh, adjusting thoracic spine is going to make your concussion go, whatever it may be.
Pick a
In
technique.
my algorithm, which I thought was pretty cool, was it's about changing the fascial planes all the way down to the big toe, changing
Sure.
your anatomy, the way your face structure is, your jaw, your breathing, and doing this stretch was like really felt so good to myself. And then tongue, and it changed my sleep immediately that night.
Yeah, you had some biometric data. And again, that's the great thing too, where I looked at that through the lens of the master's program.
Hmm.
And I go, that's a statistically significant change if you ran a t-test or so. You
Yeah.
can't really do that with a sample of
N of
one.
one. Yeah.
Yeah, there are certain statistical things you can do for a case series like that
Mhm.
that would work. But you go, if I had 40 people in a pool, I could design a study, do a t-test or a Bonferroni correction and things like
Yeah.
that, and get it to be data that is statistically significant and powerful. So you go, okay, yeah, definitely. That's the thing. There was this whole deal like cranial bones don't move. It's like, no, they move and they're part of the breath
Well, and
apparatus.
there's fascia too related to them. So with this, I felt it more on one side. So I worked that side before I went to bed, and I'd been having rib problems on this side.
Yeah,
Slept my breathing rate going down. It was the craziest thing. I immediately had mucus release, and I didn't even have I was like, I didn't even know there was mucus up in
yeah.
there.
But you
But
realize you're backed up and you don't even realize it. That's
yeah.
that's common all the
And
time.
then you could go, in that 40-person thing, it's still hard with what we do. It's still hard to do a controlled study to treat a
For sure.
concussion because of the actual neurodivergence
Yeah.
in the networks of how they are working on that individual and what's going on with them.
What is it we say? 60% of the nervous system is canalized pathways, where everybody's got a corticospinal tract, everybody's got a vestibulospinal tract, and it looks pretty similar, right?
Okay.
You've got 40% that John McLaren and Julie Brown look completely different on, right? My neocortex and your neocortex are totally different.
Yep.
And those neocortical networks that we keep talking about are what really run a lot of these systems. So
Yep.
I may do the same darn fascial stretch as you, the same exact way, apply the same exact force,
Hmm.
and I might get a deleterious result. I may be like,
Yeah.
that
So
stopped me up and my breathing sucked.
that's what I'm saying on that study you suggested if there were 40 people and we all did this. For me, I knew based on my feeling and what was going on, that was the side that I worked more because I felt it needed it
Yeah.
and I responded well to it.
And you're an
But
experienced
you
fascial
could
worker as
even like
well.
do a random, you couldn't make these people do the same thing and
Yeah.
expect the same result. I mean, that's just how
But that's how they standardize a lot of these studies. Or you
correct.
find a study where they only examine the right pupil on everybody instead of looking at both pupils or things like
Mhm.
that, just for the sake of statistical consistency and so on. But
Yes.
you and I hear that and we go, we missed half the data,
Yeah. Or more.
at least half the data,
We
right?
missed the
Yeah.
other eye, but
Yeah. Yeah, it's fine. We're
greater
only going
things
to look
are,
at the right eye with concussions.
yeah.
People that are trained, that are really trained, would go, that's just absolutely insane.
Yeah, this pupil's normal. This one is not. It's blown up,
Yeah.
it's small, it's whatever. It's the eyes
But
looking this way.
but it's cool because we're only looking at the right eye.
Yeah.
And Professor Carrick will say that if all you do is look at the right eye, you'll become a master of the right eye and you're going to miss the rest of the entire body.
On that board exam for the Fabir, there was an image put up and we had to label things based on this eye, and half the people chose the wrong eye.
Yeah.
So they missed
You miss
answers
everything. You're
because they
backwards
didn't
on
even
all but
recognize is it right or
you,
left eye?
you get the two vertical muscles, right?
Yep.
Maybe.
Maybe.
Yeah.
Hopefully you see they're straight. So
Yeah. And it's really interesting. And again, a lot of the people that sat for that exam are well-trained people.
yes.
And that's one of those things where again, different horse to beat, but it brings it back in. I did a presentation at Life West Chiropractic College talking about the pupillary light reflex as a biomarker for the chiropractic adjustment, and why I like using instrumentation in addition to the way we normally look at pupils at the bedside, which is traditionally, pen light or ophthalmoscope or whatever, checking direct consensual and then afferent pupillary defect type of responses.
Yeah.
We're looking at this, and the thing that was really stunning to me, again, talking about really highly trained people, and not to just call us out,
Mhm.
neurocritical care nurses and neurocritical care neurologists, like 60 to 80% did not diagnose pupillary dysfunction correctly.
Yeah.
So they
It's
brought
like,
them
are
in and
you
they
alive? Are
compared,
you not? That's
and
really
that's
what
and that's the
they
thing.
look at.
They maybe, and again, it's do they have enough time to really get into depth on that, or do they just want to see does it react or not?
And
Check the box, yes, no.
they're not looking at the finite little details of somebody functioning outside of the hospital in those cases. Are you alive? Are you dead? Can we get
Yeah.
you out to just
Yeah.
active daily,
But again, they missed the boat a lot more than they made the boat. And again, these are super highly trained people, which shows sometimes, and this is a topic that we have to get into, is talking about what instrumentation we like, what's good, and
yeah,
then what do certain findings with those instruments mean. Those are, not to tease the upcoming topics that we're
yeah.
going to talk about, but I know the sacodometer is a passion of both of ours.
Hmm.
And we're going to talk about that at length. And I still would love to talk about the pupillary light reflex
Yeah, I think that's
application
a
a
good
little bit
one.
more. I
Yeah.
know there are a lot of people that still ask me about it, and I did a
I haven't
presentation
used
on
it.
it
It's on my list of things that I need to invest in and use.
for
But
sure.
I haven't done that yet. I see a lot with people. It's just not quick, easy bedside on my VNG,
Yeah,
but it's not quick, easy bedside that app offers.
it really is though. It's a minute
Yeah.
tops. Yeah,
Well,
so
that's
I'll
what
just
I'm saying. And
yeah,
putting on goggles, setting it all up. I mean,
right,
it's a
right.
whole other ball game,
Yeah,
depending on what you're using.
it's just another biomarker that I like that really uh kind of tells me if I'm on the right path or not with a lot of people
Yeah.
really quickly. It's super nice, and the thing, yeah, I've had a lot of people ask me about it. It's one of those I might end up doing a class for that as we go
I
because
think
a
that would
lot of
be
people still
great.
ask me about it.
Yeah.
I did synapse and
Terry touches
it
on
was an
it in
hour.
yeah.
It's
Because
not
Terry
enough.
touches on it in his thing, but it's more in I think a more detailed, 1 or 2 hour
What is
thing would be good
what
on
does this marker mean? What are again, you talk about it, what therapies can I apply to improve those
yes.
findings, et cetera, et cetera.
Yeah.
Yeah, it's
Would a
something as we're
balloon
doing.
be a good thing?
Yeah, yeah. All those kind of things. I think it'd be really good.
Yeah. So in short, TikTok, AI, no, they don't know. I don't think AI
Yeah.
is critical enough to be able to break down. Could be proven wrong. I don't want that to, I mean,
It
of
might be
course, if
70%
we
accurate if you lead it right. Yeah.
yeah. But I do think that I just want to go into AI a little bit. If AI is able to solve these things, there are people that talk about these magical machines that basically do vibration and grow limbs back. I've heard these conspiracies
Yeah.
with, I would need to
Yep.
see that with my own eyes to buy into it. But if I go down to the molecular level and understanding light and how they stimulate DNA and this, I'm also like, okay, that would be great. But the thing that would take away, even if that could happen, the thing that takes it away is the human experience that you get from learning from mistakes or tragedies or joys or this. We're just going to be flatline. There's going to be
Yeah.
no humanity.
Oh
So
yeah. Oh, that's
in
the
a
thing.
in a concussion, not that I want somebody to get a concussion, but many people learn different things about their life,
Yeah.
maybe have a different effect on their kids from that with their there's so many things that can happen from that human experience. Not that I want people to get concussions, but if you had a magical pill, what is life at that point?
Yeah. Sometimes it's one of those things that unfortunately can happen to you, but make you slow down and realize what really is important to me,
Hmm.
what really is, yeah, what is life exactly? Where am I more than just the conglomeration of showing up to work, going to the gym, and going home and watching TV or whatever it is?
Yeah. Well, I mean, and I think if those machines exist, that would be great for someone who has a true, really bad ex traumatic
Sure.
brain injury. I don't want to take away from people who have like are paralyzed or
Severe,
whatever
yeah,
from it.
severe that aren't super amiable
Yeah.
to we have in
That can't even
more than
experience
network
life
repair issues.
anymore.
Yeah.
You know,
Yes,
that
more
would be
than
nice.
networks. Yeah.
Yeah. So, All right. Well, in short, concussion is change in function of the brain. What does the brain do? Everything. Your
Everything,
hormones, your sleep, your wake, your personality, your energy. It does everything.
everything.
So if you are not evaluating everything and understanding it, you do not know what a therapy to apply. So the
Correct.
question should not be, does that help concussion? The question should be, what is my concussion?
What is my concussion?
And then give me the list of things that may be able to apply to stimulate those parts of the brain.
And then hopefully I have somebody out there to help me decide when to use those things in an
Yes.
appropriate order, in an appropriate dosage, in an
Yeah.
appropriate manner, with the appropriate timing.
Yeah. And there's
Absolutely.
no, so we have our fellowship in traumatic brain injury and rehab. I don't think they have a doctor locator for that, but they do for the ACNB, or the diplomate in chiropractic
Yep, we
neurology.
sure do.
So everybody who's got their diplomate doesn't necessarily mean they've gone through the concussion courses and gotten their
Correct.
certification, but they still may have a better understanding than your general person who
You
has no
have,
understanding.
and again, the Carrick Institute is a great place to reach out to as well because they will point you to a Carrick trained individual in your area. And
Hmm.
I would say if you've had a concussion, and I will say this again, it'll go on my headstone, you should find and have in your life a Carrick trained person if you've
Correct.
had a concussion. If you can find a FIBIR,
Yes.
even better. If
Yep.
you can find a FIBIR who's got the master's in clinical neuroscience,
Yep. Even
even
better.
better.
It doesn't
But
mean that we are magical and
right,
are like Carrick, who is
if you can
magical.
find Professor Carrick, even better.
Even better.
But but that's the thing. Find somebody who's Carrick trained. Again, the Carrick Institute is phenomenal at helping people do that if you can't, because there aren't just the thing about ACMB is it is limited to doctors of chiropractic. We have acupuncturists who are Carrick trained. We have physical therapists who are Carrick
Yep.
trained. We have a lot of allied health professionals. We have some MDs who are Carrick trained and doing
Mhm.
physical rehab.
Yep.
So definitely reach out to the Carrick Institute, especially if you are specifically looking for a concussion doctor, and they will help you find somebody. We can help you find somebody as well. We are both very easily contactable and very
Yeah.
responsive. So
It's nicer if you go to the Carrick Institute, but we can.
yeah, absolutely.
That's more of what
That's the
they
thing.
do. We have
Yes,
to do a bunch of
we're
stuff.
we may just funnel you to them,
Yeah, yeah.
but that's the thing. If you can't get there, we'll get there. It's carrickinstitute.com.
I think is it .com or .org?
Yes, it's .com now. Yeah.
Okay, okay.
So it's www.carrickinstitute.com. Again, we're Carrick trained
And
doctors,
I
and
can leave the link in the I'll leave the link in the
we'll leave the link
description. So,
in the description.
okay. All
All
right.
right.
We'll see you
Back to
next week
work.
and talk about some other fun nerdy neuro stuff.
Awesome. Sounds like
All
a
right.
gas as always.
Yeah. All right. See ya.
Thank you.